I'm going to start broadcast, okay?
The broadcast is now starting. All attendees are in listen-only mode.
Thank you, everyone, for joining us for another learning lunch. We apologize for getting a little late in our start here, but apparently our expert who's sharing his expertise with us today is in an area with torrential rainstorms. So we've had a little bit of technical difficulty because of internet problems. We do seem to be resolving those. If we do run into trouble, we may have to reschedule this webinar, but let's begin and hope for the best. So this learning lunch is hosted by ForMedApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Training and Education with ForMed Training, and I'll be your moderator today. Today's learning lunch will cover patient engagement strategies. We are joined today by John Deutsch, CEO of New Wave Enterprises and Medical Web Experts, a patient portal and web development firm. John has a wealth of experience in EHR solutions and patient portals, and we're thrilled to share his expertise with you. Before we begin, please note that you can ask questions of our presenter at any time during today's session by entering them into the chat area during the presentation. In the second half of our session, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent via email link later in the week. Also, please note that all registered attendees of today's session will receive an email with links to both the recorded and PDF versions of the event. Now, John, are you with us now? I was telling our audience that we've had some technical difficulties.
I am here now. Real apologies here. For some reason, the GoToWebinar keeps on crashing, and we've used it many times before.
Well, and I was telling our audience that you've had torrential rainstorms in your area as well.
Yeah, the city is literally flooded right now. So.
Well, we're here now, so we're ready to begin. Before we do begin, I just want to let our audience know that I, your moderator, am recovering from a summer cold, so I'll try not to cough during our presentation, but my apologies in advance if that does happen. And thankfully, through the miracle of the internet, you don't have to worry about catching this cold. All right, John, let's begin. So what does patient engagement mean then? Tell our audience a little bit about it.
Sure. Yeah, we've got a lot of organizations that come to our firm, requesting assistance for patient engagement. I think the definition of what patient engagement is quite, everyone's got sort of their own opinion of it. But what I really want to focus on today is talking more about what my opinion of it is and what I think the healthcare organization's opinions should be. And I really boil it down to it just being a strategy that has a couple goals in mind. The first being that it actively involves patients and their health outcomes through collaboration, feedback, understanding, and education. Secondly, being to improve efficiency through automation. Third, being to generate customer loyalty through improved care. And then also to ease the transition towards performance pay, which is sort of on the forefront of everyone's mind these days. But I think the first point is sort of the biggest one. And there's a lot of different ways that an organization can involve that patient, or what type of patient should I involve, and what are the things that I could be doing online. And so we're going to dive into that a lot deeper as we go through this presentation here.
So what is the goal of patient engagement then?
Sure, yeah. Yesterday I actually met with a doctor for dinner, and he once ran the largest infertility organization in the world, and was also one of the first doctors first people to develop an EMR for the OBGYN specialty. And we were talking a lot about, what's going on in the market, what's going on with the hospitals and the practices, and, we see a lot of things on our side, but, he really boiled it down to that, in the coming years, a lot of these initiatives are sort of failing to take hold. I mean, meaningful use getting delayed, payments are getting delayed from Medicare, you know, the acquisition of private practices from hospitals and other organizations, and you know, now these contracts are up for renewal. So there's a lot of uncertainty going on. And he kind of just said, you know, that these health organizations have to really exercise a lot of caution and focus on their bottom line, because they don't really know where things are going to be in a year or two from now. And you know, we see a lot of that on our side of, you know, we're approached by a number of hospitals and private practices every day, and going through the process, we're seeing that there's a lot more cash flow related issues and a lot more hesitation. Of course, you know, EMR and a lot of organizations have had a hard time maybe with certain healthcare IT aspects. But we're starting to see it more on the cash flow side. Of course, we've been seeing for many years a lot of our private practices being bought out by organizations such as HCA or other hospitals. But now we're seeing it more with the hospitals, seeing that, you know, they don't really have the money that they did a year ago. So how can we effectively engage patients through implementation of, you know, these things that essentially cost money for both the technology as well as the staff resources to help control that implementation? How do we ensure that these are getting done fine and you know, when there is a potential cash flow issue that's happening in a lot of health organizations? So I think the goal of patient engagement in first place, I mean, you know, we could say that the goal, generally speaking, is to improve the patient experience, their care, and then also improve the business performance. But I think at this point, you sort of need that business performance in order to provide that quality of care. And so I really am consulting with our organizations more to focus more on the ROI, scaled implementations and things like that to help ensure that their investment is secure. So yeah, I would say that number one goal would be to improve the business performance, and secondly to improve patient care.
So what are HIT vendors doing then to address patient engagement? What sorts of technologies are available?
Sure. I mean, in first place, you know, EMR has been a major subject of you know, healthcare IT for the past 15 years. We can say it's a core or a first step for patient engagement. Without an EMR, it's sort of difficult to you know, to engage a patient. You need to have that structured data to support that integration to the patient portal or to the other system. Obviously, the ability to display the information that's being collected from these systems to the provider in the encounter, and then also reporting, understanding who your patient population is. You know, there's a tremendous amount of resources in EMR to do that. But EMR companies, of course, as we've all seen, have been very delayed in the process of implementing patient portals. I mean, if you look at the top EMR vendors, let's use Greenway as an example. I mean, Greenway is a company that has a lot of financial backing, and they've even elected to use a lot of third-party products for this. And you know, even other vendors such as eClinicalWorks have patient portals that you would expect something a lot more advanced for vendors of these sizes. So we see a lot of organizations come to us and say, well, we're just not finding what we're looking for. And I think that's fair. I mean, these EMR companies have done a great job of producing a patient portal that satisfies the most basic needs, such as meaningful use or provide that patient with access to the medical record online. But it doesn't really go that much further than that. And there's a lot of delays in that process of the patient using it, or hurdles that they have to jump over. So now we're seeing a lot more talk in the market about patient portals. I mean, our The number of people searching for patient portal has grown tremendously. It's a big buzzword, and one can say it's directly associated with the word patient engagement. And theoretically, the cause of the patient portal is, of course, to handle many aspects of the pre-visit as well as the post-visit. And there are a lot of vendors as well that have developed solutions that are simply to, address one element of that pre-visit or the post-visit. For example, in the pre-visit, there are vendors that have had for many years intake form systems or pre-visit education. Now that I know what you're coming in for, let me make sure you're educated about that. Reminders for their appointment. Appointment scheduling services, which have really been around for 10 or more years, and then now we're seeing a lot more on the post-visit side, which I think is where there's a lot fewer solutions, and the solutions that do exist are much more limited, and that's providing real treatment plans and education that is tied into maybe that patient's diagnosis or suggested treatments and monitoring of blood pressure on a daily basis or heart rate and weight, and having all that information feed back into the EMR for that doctor to see, well, this is how you've been trending since you've been using this medication, prescription refill requests, and then reminders to take medications now that we're seeing with iPhone apps and whatnot. So I think when it comes to patient engagement, it's more on the post-visit side than it is on the pre-visit side, because EMR companies already do a pretty good job of dealing with intake forms and maybe appointment scheduling and whatnot. But you're not going to see a whole lot on the post-visit side from these EMR companies, and that's something that we're focusing a lot more on these days, of developing treatment plan systems and other ways to kind of keep that patient engaged and reminded about certain things that provider spoke with them about in the visit and whatnot. We had a company come to us the other day, that's really interested in developing a lot more post-visit summaries, and how do we take all this information that's been fed to this patient and make sure that they understand it and are reminded of it, because most patients forget what the doctor told them, or the majority of it, by the time they leave the office. So we're seeing a lot more movement in this market. And we see it a lot from startups coming to us and saying, hey, we're looking to build this or build that. And of course, these products are, in this particular case, will probably take a year to come to market. So we're starting to see that trend a little bit more.
Well, it seems like there's a lot of potential there, given the interest in performance rather, and the growth of ACOs, that it just makes sense for the opportunity there to do that post-visit follow-up with the patient. Makes a lot of sense. Now, you mentioned modular solutions and third.
I think especially the word is engagement here. We're trying to keep that patient engaged. And the world of patient portals right now pretty much is centered around maybe an intake form and more than likely, let me see my lab results. And they don't really go too much further than that in the patient portals. And we even see it with the users of our patient portal. It's hard to get that patient to go beyond just checking their lab report and actually keeping them engaged on their treatment plan, or documenting their blood pressure every morning in the system, or so on and so forth. So as technology improves, as we see more of these third-party medical devices, the Fitbit or the Nike Fitband and all these other things that track these different vital signs and feed them through Bluetooth or other technologies to a centralized system, tying that into the patient portal is a major initiative that we have right now in our organization.
You mentioned third-party solutions and the integration challenges involved. Maybe you could say just a word about that as well.
Sure. Actually, we're going to talk a lot about that as we get into what the barriers are. I mean, why is it a problem to implement these systems? I mean, the patient portal software in itself is relatively inexpensive. An appointment reminder software is relatively inexpensive. If you look at it compared to the cost of an EMR, both in terms of initial investment for the technology and then of course the resources that are required from a staff perspective to implement it. You know, it's not really too much. But the big one, of course, is that integration to the EMR. I mean, these EMR companies, generally speaking, are very delayed. They've had a hard time. I feel that just now the EMR companies are starting to realize that there's a lot of money in them servicing their clients well and focusing on, well, if this client wants an integration, well, there's good money in that. Before, it seemed like they were all about selling licenses and just acquiring more installations and less on the ongoing services side. So we're seeing a better response now than I did 2 years ago working with EMR companies, but they're still very delayed to get things done on an interface side. There's a lot of hoops to jump through, and it can be more than a medical practice is willing to endure. A hospital is another thing. They have an IT department, and it's easier for them to move these things along, or even just bypass the EMR company altogether and develop interfaces that go direct to the database. But your smaller practices don't really have that resource. So I would say that that's the number one reason why there's a lack of adoption here. Also, really the recipe for success, and we'll talk about later, for implementing a patient portal or any of these patient engagement systems is having the staff in the organization really use them and changing some of that culture that, well, now we have a technology that will help you monitor your treatment plan and view your lab results, and getting them to be a little bit more outgoing with the patient on a lot of these things. It's just one more thing for them to learn after now they've probably just kind of got a handle on EMR. But that can be a major barrier. But we've seen it a lot with some of the organizations on how they've addressed with that through incentives, actual financial incentives for signing patients up or successfully in the portal, or using it, designating staff in the office is people who will just sort of be the champions of patient portals. So there's a lot of different ways that can be approached there, but it's something that people have to be aware of because if you're not, it is a major issue. And
well,
then thirdly, just patient sorry?
I was going to say we've already spilled a little bit into the next slide, so go ahead and continue. And I think you were about to get to this point, is patient resistance to some of the engagement through this technology. And so you talked about in the clinical setting having a patient portal champion, so to speak. Maybe you could say a little bit more about that and patient engagement as well. Sure.
And I mean, I think that the theme here is ROI, and it's taking, the EMR itself and has a lot of challenges, and in the last part we're going to talk a little bit about that. But incentivizing someone and making it a profitable business to have a patient portal, I think is an important thing to consider here. And it's important to find out the way to monetize it, because if you can't, it's just one more expense, and most health organizations can't endure one more expense. So I think the patient portal champion is a very important aspect of this, and that might be of just hiring someone new for the position, and even a position that can be partly commission-based to really incentivize that. We've seen that in some of the organizations that we've worked with, and it's worked very, very well.
So what's the best way then to implement a patient engagement strategy?
Sure. I think it's a slow process. It is a process that takes years and not months. And that's not necessarily a bad thing either, as we'll talk a little bit later. But to implement this in a staged approach with, measurable milestones, we can say, okay, we've got to the first 100 patients using this, or we've got to the first 1,000, the feedback is good, or we've now had 100 people this week complete their intake forms online, and really understanding what each of those milestones means from a financial perspective. And really just simplifying, the whole process. We want a simple solution for patients and a simple solution for the staff. And trying to come up with something that's not overly complex or has a lot of barriers for the patient maybe to use it. Maybe the hassle of getting a login or remembering their password or using the portal or something like that can just be too much for a patient. And if there's not a real incentive for them to use it, they're going to quickly give up. I also think, that it's all about the ROI, and we see a lot of companies coming to us now, a lot of private practices especially, that are dealing with obviously reimbursement cuts, or they're dealing with they're no longer able to do the diagnostic testing that they could before, and therefore they're starting to see a hit in their numbers. And a general theme is that we're recommending now is, how do you attract the right kind of patient? Might be the kind of patient that is interested in a certain type of treatment, or has a certain type of condition, or is of a certain demographic. So, we see an EMR that most people just kind of use an EMR and they don't really mind the data that much. What are your most profitable treatments, and how many of those patients are coming into the organization now, and are we seeing trends up or down of that, and how can we adjust our marketing strategy to focus on this certain patient demographic or treatment type, and using the patient portal as a way to attract these kinds of patients. And we want patients that do things on their own, and we want patients that are interested in maybe a long-term treatment plan, and so ongoing care, chronic care patients, things like that. That it's important for practices to be a lot more aware of these kinds of trends and where they want to be going with their organization. So I think it's important to consider that when adopting one of these technologies. Like I'd mentioned before, you have to be equally conscious of what's going on with your staff and the culture as the technology. If you can implement the technology, and while these technologies don't really take a whole lot to train a staff member on, it does require real conscious effort to incentivize or just encourage the staff to push these technologies on the patient and help automate the process. And then, of course, the taking the step by step and understanding that this is a one-by-one patient process. Every patient that uses one of these systems is moving closer towards the goal. And we see a lot of that with our practices that are doing marketing. It's very hard in this day and age with the competitive side of internet marketing and the reimbursement rates to implement, say, a marketing strategy and to experience a positive ROI immediately. Maybe the cost to acquire a patient is $500, and you're only going to make $200 on that patient. But it's a step in the right direction to then say, okay, the patient cost us $500 to acquire. How do we get that down from $500 to $300, and then from $300 to $150? And that same approach has to be taken with the patient portal. To implement something, expect patients to use it, or for the staff just to automatically start recommending it or anything is a little bit unrealistic. You have to take that marketing approach, start attracting the right patients and understand what it costs to attract that patient, and then what does it cost in order to get them to use the patient portal and then develop a trust in that practice and become a repeat patient. So it's important to break that whole process down. And also to consider just implementing these technologies for certain types of patients. I mean, not all patients are candidates, or all patients, it doesn't make sense to put all patients in there. A lot of patients aren't interested. So maybe you are trying to break into a weight loss program with your patients, or that you have a lot of diabetes patients. Well, you can just develop or implement one of these patient engagement tools simply for that patient demographic. And that's going to keep it in a much more controlled environment and allow you to tailor the the patient portal to that patient and their needs, and then of course break into additional patient types as you successfully completed the first. The other thing is really to understand, what is that patient actually using this for? I mean, there's not a lot of benefit for the patient to fill out their patient intake form online. I mean, why not? I just go to the office, I fill it out there, I'm probably going to have to wait anyways. But when you start understanding why the patients use it, it's generally for lab results or appointment requests or a lot of communication with the doctor. I mean, I had a visit and next week I have a quick question, and I don't have the doctor's cell phone number. I'm not going to call the office and try to get a hold of the doctor. To know that I can go online and ask someone that question, and then of course, be either have that answered or be routed to having another appointment or whatnot, offers an incredible amount of value to the patient. So understanding what makes the patient tick with using these technologies is very, very important. We've seen, actually most patients use it for labs, but what I would say is being the most successful thing that I've seen in patient portal, in a practice of patient portal strategy, was the implementation of a health coach. And that health coach was typically a dietitian or more of a lower level provider, physician's assistant or whatnot. And they would simply look at the patient's medical record, look at the treatment plan that's created by the doctor, and engage the patient through the portal, asking questions. How is this coming along? Have you been keeping up on your diet goals? Or just providing that patient with ongoing support, not waiting for the patient to come to them, but actually going to the patient. And that created a network of patients that were almost becoming dependent on these people and using them for that support that they needed in their treatment plan. And it was really quite incredible to see that core patient base just continuing to use the system, and they really became the ideal patient. And the amount of time that health coach would spend with the patients was really minimal. If you think about how many patients one person, which doesn't really occupy that much of a salary, how many patients they can handle in this remote way, it's easily a few hundred active patients, and those patients are typically chronic care patients or ones that are going to be coming in for regular visits. So it's definitely a nice strategy to use when if someone's implementing their patient portal.
So what are some of the HIPAA and other legal concerns around patient engagement then?
Sure. We generally just see about three things. I mean, there are obviously other elements, but the first one that always comes up with all of our patient portal installations is, how are you going to authorize this patient access for their medical record? And there's a lot of different approaches. HIPAA doesn't really govern that too much. I mean, there's ways that you can say, okay, a patient will have to go to the office and get their username and password, or a patient can fill out the registration form online, and if their form matches a certain criteria of maybe first name, last name, date of birth, zip code, and last four of Social Security number that will automatically grant them access. For a lot of organizations, that's fine, and there's no HIPAA law that would govern against that. Some people say that that might be a little bit insecure, and that's certainly true. There can be other challenge questions, or we do second-level authentication where maybe their telephone number on file will get a phone call and a PIN will be delivered. I mean, that's sort of the best, most automated way of dealing with it. So having a strategy for how medical record authorization is done is a very important question to ask yourself, and it's something that becomes a much bigger topic than most people expect as they're going through this process. Because obviously, the process of having, making the authorization process lengthy for the patient will simply just have the patients not use the portal at all. Secondly, you have to have an audit log. So everything the patient does, they log in to the patient portal, they register, they access their medical record, change their medical record, do a consultation or send a message. There has to be an audit log tracking all that the patient cannot edit. So that's something that we've had to develop in our system. And then, of course, having secure access. This is a simple one, but a lot of organizations are still implementing patient portals, or especially contact forms. It's technically illegal, and we've had practices that have been approached by governing bodies for a simple contact us form on their website that asks about appointment information. That contact us form is almost always sent unencrypted, and if there's patient information in there, and even the patient name technically could be included with that, that needs to be a secure form. So we're seeing a lot of organizations adopt, more secure ways of dealing with that than, their typical contact us form.
So you've talked about this a little bit, but please tell us more about how practices can market a patient engagement strategy.
Sure. So, obviously the culture and the staff side is a very important concern. But there's other things that we do a lot of with our organizations in terms of marketing. Of course, I think anytime you're dealing with the word patient engagement, it generally means online, and it generally means you should have a website. So something that first would attract the right kinds of patients, and then give them the tools that they need online to do so. That attracting the right patient, of course, requires some level of internet marketing, and you can market your organization for any particular treatment or any particular demographic. I can say in a Google ad, I want my ads to be displayed only to women between the ages of 30 and 50, and I want it to come up, with the keyword only, mammogram-related keywords or something like that. You can certainly do that with Google AdWords, and that will help drive the right patient to your website, and then you tailor your website for that type of patient, so you're going to have an optimal conversion. And chances are, if they're searching online, they're probably fairly internet savvy, and they're more than likely to use these online tools. But one of the things that most people overlook, and we've seen to be very, very successful, and the cost is almost irrelevant, is putting posters all over the office, in all the treatment rooms, in the waiting room, in the checkout room. We've seen, the cost of printing a poster and to put it into a nice frame. You could do 10 of those and scatter them throughout the office. I mean, that's an under $500 investment, and then you can use these posters to market to your patients. Such it with headlines that say, want to access your lab reports as soon as they become available, ask your doctor or ask at the checkout desk. Take your medical record with you, and we would show a picture of a keychain with a little keychain tag on it that had the phone number for emergency medical record access. And these were incredibly successful at engaging the patient. So that's a good one. Also, having a kiosk and a workstation or a tablet that the patients can fill out their intake forms there works well. And what we see a lot of is if the provider is not on board or recommending these technologies to the patient, there's very little chance that a checkout staff can do that, because at the end of the day, patients listen to their doctors. They don't listen to the checkout staff. So it's important that there's a connection between the provider and the checkout staff, such as, would you like to receive or see your lab report when it's done online? Oh, I would love that. Great. So as you take that patient out, you then say to, Wendy at the front desk, Wendy, can you please make sure that you sign John up for the patient portal. And that really improved the adoption rate. But then, of course, is only the first step. Whether they use it afterwards is another story. And then having something they can take away. We mentioned the keychain tags or little cards they can put into their wallet with information about accessing their medical record in the event of emergency. And then, of course, word of mouth, which is some tools we use in our portal to encourage patients to recommend someone, or if there's other, naturally as you provide a good quality service, that should take off.
So what's the difference then between developing a patient portal to satisfy meaningful use versus developing a patient portal to promote patient engagement? Tell us some about that.
Sure, yeah. We get a lot of requests for patient portals or different patient engagement tools that will maybe develop off the patient portal or develop from scratch. We do a lot of custom development, and I always see two different attitudes with this. And there's the organization that approaches us for meaningful use purposes, and then there's the more educated one that approaches us for meaningful use along with having a tool that will actually earn them more money or satisfy a business need. I think if an organization is looking for meaningful use, to satisfy meaningful use, they need to look at the simplest, most cost-effective way of doing that. And that usually means implementing the patient portal that comes with their EMR. If that EMR does not have a patient portal, then you should probably reconsider why you're doing it, because the cost of implementing a patient portal and either interfacing it or doing it manually might be cost prohibitive for what you would gain out of meaningful use. I think it's just the reimbursement amount, the time in which it's reimbursed, should not be the major driving factor for implementing a patient portal. A patient portal needs to be seen as a way to increase revenue and actually improve the business. And if the only benefit or the only goal is to satisfy meaningful use, I think it's very short-sighted. But we see that being very financially motivated simply on the reimbursement. They're trying to meet a certain level of compliance, whether that be for HIPAA as well. And their goal when it comes to actually patients using it, or the requirement, actually, for that matter, for meaningful use attestation of how many patients actually have to use the patient portal is very minimal, to the point that you could just do it manually, and there's no, that doesn't really come at any significant cost to the organization. It's very easy to fake that you can do these things, but that obviously is going to become a bigger issue in the stages that follow here. But with the patient portal, we see an attitude of, we are launching a new service and we want to have the patients, manage their diabetes online, or we have a new weight loss program that we want to implement, and we're using the patient portal as a way to facilitate that program.
So what are some of the costs involved? You've touched on this a little bit, but maybe we can get into more of the details about what costs should be expected.
Sure. The patient portal, I mean, as an actual technology expenditure, I would estimate it being 1/5 of what an EMR you would implement it. By the time you consider, all the servers and the other technology, the computers and whatnot, the patient portal is sort of in the cloud, and you just basically pay a licensing fee, maybe an interface fee, and then you're off to the races. So from that perspective, it's relatively inexpensive. It has a lot less time required for training, but you might see obviously an increase in costs related to actually making it successful through a product champion or incentives or things like that. So there's a lot of new costs that you can see that are associated with implementing a patient portal.
Well, that gets us through our main presentation, but I know that we're going to have questions from our audience. To remind our attendees, if you have questions for our expert, just type them into our chat area and we'll share them with our expert and get his answers for you. But to begin...
Yeah, and I've actually got one more point here that wasn't included in the slide.
Well, please go ahead then.
That I sort of spent working on this morning. So it really ties into sort of a big picture of why we're doing this and avoid the health IT ROI trap, as I call it. When it's a fair assumption that all organizations have implemented a billing or a practice management system, they're all relatively happy with it because it's a relatively unified process. Process of insurance billing is quite simple. It's all the same. Whether you buy one billing system or the other, they essentially do the same thing. And they all have a positive ROI because no one can argue that using QuickBooks or using Advanced MD or something like that doesn't actually provide a direct return on investment. But it's also a fair assumption to say that EMR systems frequently produce a negative ROI, and that in almost all cases fall short of their ROI expectations, especially when these are not fully implemented, or that the data, most importantly, of the EMR is not actually being used or leveraged for other purposes. If all the practice is doing is implementing an EMR and using it for clinical documentation, they don't really do anything with the data, then there's not really a whole lot of direct ROI value to an EMR. And many would argue that there is none. And why is that? I mean, that's simply just because EMRs don't have a unified process. There's a lot of moving parts. Every provider does things in a different way. There's a lot of time to implement these EMRs and adapt them to the way that provider practices. And it's just an overly complex issue. And I think a lot of organizations have just simply been burned, and they've lost focus of what HIT is and how to use technology, because for the past 10 years they've been in the EMR race and trying to make this work, and this is coming at a time when reimbursements have gone down, and it's become a very difficult situation. But I kind of see patient engagement as like a PM and billing system. Why? Because it's a unified process. All patients will generally use it the same way, and they're all doing the same thing, and the data that moves in between the EMR and the patient portal is pretty much the same data. It's lab data, it's an appointment request, it's a message. I mean, it's a very simple system. There's obviously a lot of barriers as we talked about, patients using it, training staff, and the EMR integration, which isn't necessarily a requirement. But it's a unified process, and it comes at a much lower cost, has a much lower risk than what people have experienced with an EMR. And I feel that to use one of these tools is sort of connecting all the dots. I mean, you had one software that's worked very well. You've got a second software that has questionable return on investment. Bringing in this patient aspect, bringing in the website aspect, and marketing properly to the right patient base, improving, increasing cash-based patients, and connecting everything together is sort of that missing piece of the puzzle that, of course, we're all trending towards. But it's important to see how a patient would come to you as a new patient, go online, perform certain things that you need from them, come into the office for a visit and have that visit document in the EMR, get the information back in the patient portal, pay their bill online, or at least see the summary of their bill, or have billing aspects and how they all connect together. I think it's very important to look at that from a big picture. So there's some things that I think people need to be concerned about when they're going down this road. The first being the integration of the EMR. The integration of the EMR can be time-consuming, can go out of budget, and it's important to first prove the concept of the patient engagement without that. I would always say make sure that you can do the EMR interface, but implement the tool without investing in that, because it's not a requirement to do so. You can simply hire a patient portal champion that manually moves the medical records over for a certain type of patient and consults with the patient to make sure they're happy and helps to grow the whole thing. And when that becomes too labor intensive and you can say that there's a cost benefit to having an EMR integration, well then you do it, and you know exactly how to do it. You know what you want to move over and what you don't want to move over. But I think making it an initial requirement is a very dangerous thing to do. Also having lofty or high goals for the adoption. Will the patients use it, and we're going to have all of my patient base use it. When in reality, you'll probably only get 10% in the first year using the patient portal, and maybe only 5% of those really using the patient portal. So, step by step and understanding that, it's a process. Avoid high-cost solutions. There's a lot of solutions out there that are extremely expensive, even some that are coming with the EMR. I mean, I've seen some from some vendors, $150+ per provider per month, huge setup fees, huge interface fees. So looking at a solution that is simple and cost-effective and proving the concept, it's very easy to transition from one patient portal to another as your needs grow. That's obviously not the case with an EMR, but you've already got the data in the EMR, so it's not that hard to purchase another one and have that implement and pull the data from the EMR, and then you're all set. We've done it with a lot of practices, and it's amazingly simple. The process of clearing the database and putting them into another one. And making we've talked about meaningful use, making it an important aspect, but not making it the most important one. And then really strengthening your investment by making marketing a very important part of your patient engagement strategy. And that should coincide with attracting the right patients, an in-office marketing plan, an internet marketing plan, and being diligent, staying with that marketing plan and the patient portal all the way through, and actually tracking the results of the patients coming in and the patients using it to really bring that patient acquisition cost down to a profitable level and ensuring that you can get that repeat business that you sort of sought out for with the patient portal to begin with.
I'm glad you added those remarks because I had some questions around monetizing the system that I think you addressed very well there that helped me understand a little bit more about how that would work. That makes a lot of sense. Here's one question. We don't have a lot of time, but we do have time for at least one question, and then I'd like to remind our attendees that any unanswered questions will follow up in an email to answer those questions. But meaningful use, you said, is not really the key consideration in adopting a patient portal, but the question is about meaningful use 3 and whatever lies beyond that. Do you anticipate that driving more use of patient portals? Is that going to be an important piece of that?
Oh, I think so, but more than likely that deadline is going to get delayed. I mean, people are already behind. You can say that this whole process has been a relatively failed process. While, you know, it has accomplished some goals, you know, practices are very behind on this. That if your only goal for meaningful use is just implement anything, you know, take the easiest road you can find for meaningful use, you know, related to what the requirements are for your patient portal as to where your EMR, what it can do and what it can't do, and find the simplest way to bridge that gap. And then when in a year or two, as you've gotten your feet wet with it, switch to a real solution if you're ready for it, or just do it all at the same time now. But you know, I think it's a dangerous game to look at implementing a really complicated solution for meaningful use, and you know, the integrations. I'm seeing it with the hospitals and the private practices, and they're so far behind. The integrations are delayed. I mean, it's a giant mess in my opinion.
Well, we're nearly out of time, so I think we'll go ahead and wrap up for today. Because we do have limited time, again, to our attendees, we're going to assemble your questions and post the answers on our site with links delivered via email later in the week. I'd like to thank you, John, for joining us for today's Learning Lunch.
My pleasure.
To learn more about our industry expert, John Deutsch, and New Wave Marketing, please visit www.newwavemktg.com. You can see that on your screen there. I'd also like to thank all of our attendees. Remember that all registered attendees of this event will receive an email with links to both recorded and PDF versions of this session. Be sure to join us at Format Approved for our upcoming learning lunches by visiting our homepage at formatapproved.com. Simply click on the button near the bottom of the page to register or to learn more about those events. Our next learning lunch will air tomorrow, May 29th, and we'll cover the subject of what is a meaningful use audit. Keep an eye on your email box and our homepage for other upcoming topics. And thank you again to everyone for joining us today. And thank you again, John. I thought it was a very informative session.
My pleasure. Everyone have a great day, please. Actually, on our website, you'll want to direct to our medical side of the business, which is medicalwebexperts.com. That's also accessible from the link that was on the presentation. New Wave is our parent company.
Oh, thank you for that clarification, and we'll be sure that the slide reflects that change as well when we send it out to our attendees. So thank you again to everyone, and we'll see you again soon.